With mental health at the forefront of Black culture and psychological studies, it begs the question: does the Black community shy away from addressing mental and emotional health issues?
It's not really something that we really talk about.
It's looked upon as being a negative thing in the Black community.
I'm just going through a lot. It just feels as though I don't know who to talk to.
Mental health services have not always been as, I think, considerate of cultural differences. But there is some stigma. Does this mean that I have that it's weak? Does it mean that I'm crazy? All of those kinds of labels that can be assigned, which are really unfair, because I actually think of seeking mental health as a sign of strength, is recognizing that there are some issues that you want to address and being proactive about addressing those issues.
While some members of the Howard community believe that most Black people shy away from addressing mental and emotional health issues, Howard University alumni and psychologist Dr. Nicole Cutts has a much different perspective.
I think the larger American culture to some degree does stigmatize mental health issues and the idea of going and getting treatment, but I don't think that that's peculiar to folks in the Black community. What determines in large part whether or not people shy away from mental health services has more to do with people's socioeconomic status and their upbringing, their exposure, and their education.
According to the National Institutes of Health, there are differences in stigma among cultural groups. While explanations as to why these differences exist are rarely known, studies indicate cultural values are important with regard to stigma for Asian Americans and African Americans in particular. Less is known about the interaction between cultural values and mental illness for other cultural groups. But how do we, as a community, combat the overlying issue of stigmatism?
Educate yourself. You should also be sensitive, I think, in your language, in not engaging in microaggressions. I think that hiding it, feeling that shame, helps to perpetuate the stigma.
For News Vision, I'm Vania Brown.